Hello, everyone, and welcome to this online event, The Present and Future of the HIV Policy Landscape. This discussion is co-hosted by the HIV Policy Lab at the O'Neill Institute for National and Global Health Law at Georgetown University and the Kaiser Family Foundation. I'm Katie Gottschalk, the Executive Director of the O'Neill Institute, and I'm honored to be welcoming you to this event this morning. Today's discussion centers on the current landscape of HIV policy and its implications for the future. The science of HIV is better than ever, but the policy environment still leaves too many behind. Analyzing the law and policy landscape is essential to advancing the effort to stem and prevent the spread of HIV, improve the lives of people living with HIV, and prevent death from this disease. The O'Neill Institute and its partners, including Georgetown University, UNAIDS, GNP+, and others, will with support from PEPFAR, launch the HIV Policy Lab in order to support policy change through partnering with public health leaders in government, civil society, communities, financing agencies, and political settings. The lab tracks the adoption of 33 policies across 194 countries. Today, we're honored to host a discussion with several leaders from the HIV policy sphere. These speakers are researchers, analysts, activists, and policymakers with deep experience who will share the latest data on how the policy environment is and is not changing. Before I turn it over to Jen Cates from the Kaiser Family Foundation to provide some opening remarks, I'll give you a brief overview of today's event. First, we'll hear from Matt Kavanaugh, who some of you might know as the director of O'Neill's Global Health Policy and Politics Initiative, but who's currently on leave as the acting deputy executive director at UNAIDS. Matt will speak on the state of HIV policies, how far we've come, the current landscape, its progress, and its pitfalls. Next, Jen Cates, Senior Vice President and Director of Global Health and HIV Policy at the Kaiser Family Foundation, will discuss findings from a new foundation analysis of HIV policies in PEPFAR-supported countries compared with those in non-PEPFAR-supported countries. Cedric Nihanihanasan Cedric, my apologies, the Global Advocacy Manager at the Global Network of People Living with HIV, known as GNP+, will speak to the structural issues, the UNAIDS 10-10-10 goals, discussing what the world needs moving forward and what is needed from the governments and global health actors. We'll then hear from Dr. Anjali Ashokar, acting US Global AIDS Coordinator, who will discuss what PEPFAR has done to date and what is expected from the current PEPFAR country operational plans in support of policy change, including the UNAIDS 10-10-10 social enabler targets. Finally, to conclude our event, we will have a Q&A moderated by Matt Kavanaugh. We welcome questions from the audience, so please post them in the Zoom Q&A box. With that, over to you, Jen.
Great. Thank you so much, Katie. And I just want to say a few words of welcome to everyone and also to thank the O'Neill Institute for co-hosting this event with us. It's been a really great collaboration. And just reflecting back, I remember a few years ago when the O'Neill Institute mentioned that they were going to put together this database to sort of add to all of our ability to track the policy environment. And here we are. It's really exciting that it came to fruition when it did a couple of years ago, and it continues to grow. And I just encourage everyone to not just review it, but use it. Use it for your analysis, use it for your own activism. There's a lot of information there. Before I go on, I just want to make sure I thank my colleagues at KFF, in particular, Anna Rao, who led our analysis, the data I'm going to present, and Alicia Carbow, and then also Emma Anderson. So thanks to them. But really, the idea behind this event is that we wanted to shed light on the role that the policy environment can play in both promoting better HIV policy and outcomes, but also impeding those outcomes if the right policies aren't in place, and try to understand, where are the pressure points, and what specifically PEPFAR is doing to try to push change in the countries in which it works. I'm not going to talk anymore. I really just wanted to say welcome and thanks, and it's really exciting to see everyone who's here. And I'm going to turn it over to Matt, who's going to give the first presentation. Thanks.
Thank you, Jen, and thanks everyone for joining. As we go, we'll welcome conversation in the chat and also in the Q&A. And so please go ahead and enter pieces there as we go. So I'm going to share my screen here now. And the core of what we want to try to talk about today, as we have, is this idea that we can think about law and policy as an intervention in the HIV pandemic. You know, we often think about the interventions, including how we supply people treatment, how we get various prevention interventions into people's hands, what kinds of community-based programming. But we often neglect to think about HIV policy and laws as an intervention. And yet we see again and again in the HIV pandemic, the driver of access and the driver of change is often the policy space. And so we are looking at the policy environment. Thank you to GNP Plus, to the O'Neill Institute, to UNAIDS as a whole for co-sponsoring this really important piece of work. And so I'm here today quickly to run through a number of the different policy findings from the 2022 report. The HIV Policy Lab, as many folks here may know, tracks 33 different policy indicators across 194 countries with 4 years of data and counting, and you'll see some of those pieces. And you can find more information at policylab.org. There are the HIVpolicylab.org. There are kind of a set of key takeaways that I'm gonna share with folks here. And the first piece to say for 2022 is that we still have a situation where no country has adopted all 33 different indicators when it comes to recommended laws and policies. The important thing to say here is that these are not, this is not a measure of a kind of unimaginable standard of attainment, right? These are the basic policies, 33 of them, that have been recommended by the World Health Organization, by the, by the UN bodies, that have been committed to at high-level meetings by member states, that are aligned with the Commission on HIV and the law that really made a number of really critical interventions that was created by UNDP and others. This is the kind of basic kind of infrastructure that we should be thinking about. So good here looks like 100% alignment, right? This is not go above and beyond. This is not a matter of kind of radical ideas, but these are instead 33 core indicators that are best practices in the world. And yet we still see that no country in the world has adopted all of them. Interestingly, we also see from this new 2022 report that there is significant variation in policy adoption across the 33 individual policies. On your left, you can see some of the policy adoption successes, right? Where do we see high levels of alignment? This doesn't mean it's fully adopted, right? And the point is what we should see is hundreds across these, right? Ideally, if we were really orienting toward a policy environment that is aligned to end the AIDS pandemic, but certain pieces of these have really kind of taken precedent. The move to treat all is a really good example. A few not that long ago, this was actually somewhat controversial, and now it's universally taken up, except for a handful of countries. On the other side, we see that in each of the different policy areas, there is some that have done that have high levels of adoption, and some that don't. I'll note several of the criminalization pieces, but also age restrictions on testing and treatment that make it a barrier for adolescents to access care. Also task shifting, which is somewhat surprising. The idea that nurses should be able to initiate care is not nearly as widely taken up. And we see that PrEP, despite its importance, actually is not well aligned at a deep level. Key takeaway 3, on average, about 68% of the clinical and treatment policies have been adopted. So here's an area where we have seen really remarkable work, right? And this is an acknowledgement of the work that countries and governments have done to really align their policies with clinical best practices. And also the work of the World Health Organization, of PEPFAR and others to ensure that these policies are best aligned where we possibly can. And it shows that actually policy adoption is possible, though there is still a significant places to go when it comes to this area. On the other hand, only about half of internationally recommended testing, prevention, and structural policies have been adopted. This is a map that shows the testing and prevention policies, right? And we see here that, interestingly, East and Southern Africa is actually leading the world in many ways on testing and prevention policies. And I think this reflects real leadership from many of the countries in the region, although, again, we only see a handful of blue. And that is a real marker of that we've still got a little ways to go before we have an environment that actually supports people. Other pieces to call out from the report: children and adolescents continue to be left behind in the global response. This is a map of age restrictions on testing and treatment policies. And what we see is that the blue here is those countries that have removed age restrictions when it comes to HIV testing and treatment. Some have removed it for one or not the other, but here we see a lot of countries that have not actually moved unaligned. So this is one that we want to call out as a major global barrier when we think about what it looks like to have successful movements here. The other is that we have a huge opportunity, especially in the wake of COVID-19, to really move faster on differentiated service delivery. Here is the adoption of policies. The blue bar represents those countries that have adopted multiple different differentiated service delivery policies. That means things like multi-month dispensing, fast-track dispensing, community-based ART, those pieces that allow people to get their medicines in communities and make it really simple. Here, what we see is the blue bars are multiple. They've adopted most of what the WHO recommends. The yellow bars are where there's at least one, but they haven't adopted most. And the orange bars are those that have adopted none at all. And what we see is that actually East and Southern Africa is clearly leading here. And interestingly, we see Western and Central Europe and North America actually lagging significantly behind, right? There was actually policy innovation in the global South that the global North actually needs to learn from when it comes to pandemic response. And we think this is important. I'm going to turn from here to a quick overview on the 10-10-10 targets. At the UN high-level meeting on AIDS that happened in June, we saw adoption for the first time by member states of a very clear set of targets on law and policy alignment. The commitment is that actually less than 10% of countries will have restrictive legal and policy frameworks that lead to denial and limitation of access to services by 2025. And that is, of course, linked to ensuring that we reduce stigma and that we reduce the effects of gender-based inequalities. That movement is to my knowledge, and I actually should know this, so I should stand corrected if I'm wrong. I don't know of any other kind of area where globally UN member states have all committed to law and policy change, but they have at the UN high-level meeting. And that's an important reflection that actually the future of ending AIDS has to be about kind of aligning our policy environments. So how are we doing? So the Policy Lab, in collaboration with the O'Neill Institute, with UNAIDS, with GNP+, has done an analysis of the social enabler policies. Where do we stand on criminalization? These policies that you see on the left, criminalization of key populations, as well as the movement toward having national human rights institutions that are independent, where people can go, having gender or sexual orientation, HIV status, all included in non-discrimination policies, and having clear gender-based violence laws. And the word that we have to say is that no country in the world has adopted all 7 of these. We've still got quite a ways to go. But on average, countries have adopted 3 of the 7 policies. And across the spectrum, no policy is not adopted by any country. You can see here on criminalization where we stand, and we stand in a context where most of the world criminalizes, one or the other, but we are seeing significant change here, and especially when it comes to partial decriminalization of sex work, partial decriminalization of drug use for personal consumption, significant movement on same-sex decriminalization, and HIV exposure. We see here, there's also a set of protective institutions. We don't want to just talk about removing laws that undermine the AIDS response, but instead about what are those laws and policies and institutions that support the environment that we need. And here we can see proactively that there's global progress to be made on ensuring that there are national human rights institutions where people living with HIV, key populations, and others can go for redress when violations happen. The expectation in human rights context is not that there will never, ever be a violation, but instead that there's a way to redress it. Also that we have discriminatory, anti-discrimination laws and gender-based violence laws. This is a quick kind of snapshot of a paper that we published last year that shows really clearly something important, which is that in the last 5 years, under the last global AIDS strategy, empirically, countries that criminalized same-sex sex, that criminalized sex work and drug use, they made less progress on the 90-90-90 indicators at a population level, right? At a population level, a lower percent of people knew their status in criminalizing countries, and a lower percent of people living with HIV achieved viral suppression, where criminalization was the case. And so here we see that we can't think about biomedical and structural interventions as two separate things, but instead understand them as deeply linked. In criminalizing contexts, we have a hard time having effective biomedical interventions to achieve our targets. On the other hand, where non-discrimination laws were clear, when global human rights institutions were strong, and when gender-based violence laws were clear in there, we saw better uptake of the 90-90-90 targets. I'm going to close with this slide that shows us a little bit, and we haven't actually included this in the report. This is data to come. We've just finished it, but that shows that actually progress is possible. And that if you look here, we can see, in fact, that this is a visualization from the HIVpolicylab.org website that you can show each country, where are they overall, and on each of the different paradigms in each of the different areas. And what we see here is that if we go along, we can actually watch and see different countries. Where are they? Which countries are doing well overall at aligning their policies? Which countries struggle? We see many of those that have made the most progress at the top end. And then we see those countries that really have aligned very little of their policies with HIV prevention and treatment and other data. But we also see progress. Here's 2017, and here is 2019. We're seeing progress. And here's 2020, even more progress is being made at alignment. In 2021, though, we saw a slight backsliding. And what we see here is that overall, policy movement is happening. It's very possible. And so the core message we have here from this report is we can take forward policy change. It is possible, but what it takes is all actors within the global health sphere and within the HIV sphere rowing together, identifying which barriers are the biggest in the policy area for a given country or even a given city, right? And identifying those, shifting those to improve the policy environment. And that's actually how we get it, whether it be a PEPFAR coordinator, whether it be civil society activists, whether it be governments, whether it be UNAIDS country teams, whether it be all through the UN. We can have an impact if we identify which policies are the most important to change and put our weight behind it. So with that, I will hand back over to Jen Cates for the next presentation. Thanks so much.
Thank you, Matt. All right, let me share my screen here. Okay. Can you all see that?
We can.
All right, great. Okay, so thanks, Matt. That was sort of exactly hearing your pitch on why this is so important was what prompted us to want to use this database. We have at KFF been doing some in-depth work to look at PEPFAR's role in combating HIV, sort of the evolution of the program, its changes, and sort of what's ahead. And we were very interested in trying to understand sort of how the policy environment, or sort of what's the current snapshot of the policy environment in PEPFAR countries, and how might that compare, in our case, to other low and middle income countries where PEPFAR is not working. So just with that in mind, and this was our impetus, we know that the adoption of evidence-based policies is critical for ensuring success of HIV programs, and the report, the analysis that Matt and others published is some evidence of that. And also, while PEPFAR's main focus, as we all know it should be, is on HIV service delivery, it also has supported countries' adoption of policies to address the structural barriers and to increase access to HIV services. And that is an increasing emphasis of the program that I'm sure we'll hear more about as we go forward. So what we decided to do was to use data from the HIV Policy Lab to look at the policy environment in PEPFAR countries and compare the policy landscape to other low and middle income countries, and just see were they all the same, were there some differences, what can we say about PEPFAR countries? And I don't have a lot of slides because I think the discussion will be the most interesting part. But what we found actually was that PEPFAR countries had stronger policy alignment with international standards than other low and middle income countries. The average policy adoption score, Matt was showing some of these, for PEPFAR countries was 60%, compared to 48% of the other countries that we looked at. PEPFAR countries also scored higher in 3 of the 4 areas. So the policy lab looks at 4 big areas: clinical care and treatment, health systems, testing and prevention. as well as structural interventions. And as a group, PEPFAR countries scored higher in all of these areas compared to the others. They were tied on structural interventions, and we'll talk more about that because that I think we all recognize is going to be the challenge for all of us going forward in this work. Policy alignment was strongest in the areas that PEPFAR directly supports, so clinical care and treatment, as again, we might expect, and weakest on structural. Also, and you can see all of this in our report, which is on our website, it came out just a few weeks ago, policy alignment across the countries varies substantially. There's a range. For example, the lowest adoption score was 33% in Trinidad and Tobago, and it was 82% in South Africa. There's a variation when you look more in depth at the indicators. So all PEPFAR countries had adopted viral load testing standards. None has adopted policies related to drug use non-criminalization. This is not unusual, the United States being another example, but we just, structural interventions continue to be the big challenge ahead. And then for some structural indicators, other low and middle income countries did have stronger alignment, such as for same-sex non-criminalization and for HIV exposure non-criminalization. Here you can see the adoption scores for PEPFAR countries as a group compared to other low and middle income countries. PEPFAR countries are in the light blue, and you can see the overall score, the 60% compared to 48, and much higher on clinical care and treatment, 83% compared to 61%, and all the way down with, as I mentioned, structural being the area where there's a tie, but also not to overlook that some of these are still, for other countries, testing and prevention alignment is quite low. It's below half. So PEPFAR is performing much better in that area as well. This is just to show you, much I mentioned, there's a range of countries. We pulled out for this the top 10 by adoption score. So this is overall score. And you can see the set of countries that are just scoring the highest across this broad range of policies that are PEPFAR countries. And for those of us who work on PEPFAR issues know that several of these are just very important partners for PEPFAR and has been working for a long time with them on some of these policy issues. So what are the implications that we see with this analysis? I think first, as I mentioned earlier, PEPFAR countries are outperforming other low and middle income countries on a range of these normative indicators. We did not establish causality, so we can't say for certain this is because of what PEPFAR is doing, but we all know from the work that PEPFAR does for how long it's been in these countries and from the guidance as it's evolved over time, it is very likely that there is a direct relationship. At the same time, there's a significant share of recommended policies that have not been adopted, particularly in the area of structural barriers. Now, these are the hardest to impact. They often require national legal change, or they reach beyond HIV. They're not just HIV specific. So these are not ones that are easy for PEPFAR, for the Global Fund, or really for any external entity to try to influence. As I mentioned, while we can't establish causality at this time, we do believe that these findings serve as a baseline for assessing and looking ahead at PEPFAR over time. And of course, as we will hear in a little bit, the COP22 that has just been put out by PEPFAR, we think could have additional impact. It really is, in terms of the evolution of the COP guidances, hits on many of these issues and is actually now requiring country teams to address many of these normative areas. Looking ahead, some future analyses that we could be doing or others could be doing is to assess trends over time. Now that the HIV Policy Lab is going to have some longitudinal data, I think it gives a lot of opportunity to look at how PEPFAR support correlates with some of these outcomes, and whether it's significantly associated with PEPFAR over time. There's a lot more in the report. We break down PEPFAR countries across all the 33 indicators, so you can actually go in and see how countries are doing, scoring on any of the indicators that is tracked by the Policy Lab, and a lot more detail there. With that, I'm going to end this presentation and turn it over. We're going to enter our discussion phase, and I'm going to turn it over to Cedric, who's going to lead us off.
Yeah, thank you so much, Kate and Matthew. I think you've just shared very important data and that should tell us how far we are actually. And maybe first of all to congratulate, as you mentioned, Kate, PEPFAR, to the support you're providing to countries. And I think if it's already making difference, that means there's a hope. But then for the audience that is following, I wanted probably to first share what does those policy look, how does those policy look like? What are some of the examples that, because if we talk about the policies, and what are those policies that are really making the life of people living HIV and people from the Cape population community. We are talking about policies that restrict someone to, take health insurance, for instance. This is a case of a country like India. We are talking about policies that, when we know that you are HIV positive, for instance, you will lose your medical practice license just because of your HIV positive. We are talking about that kind of impunity, which is supported in a certain way by government to the law enforcement to allow themselves to jail a person just because they're a sex worker. We are also talking about impunity that is kind of institutionalized and allow perpetrators of gender-based violence to keep running around while victims are crying or dying. We are talking about those laws that allow law enforcement just to treat someone because of their sexual orientation, going to the extent that they can kill them. These are the laws and policies that we are talking about. And I think if these numbers are higher this way, and then we have already set our target for 2030, is it possible? Just to remind also, this is, yes, a commitment that was made in the political declaration in 2021. We had a similar commitment in 2016. Shall we believe this, or something need to be done? That's a question, but also we're still wondering if we can really believe that the commitment will be fulfilled in a way. I'm saying this to mention that we are talking about policies, but we are talking about lives of people who are being really put in danger every day, life of people who cannot live freely their life just because of these policies, life of families of sex workers, families of people living HIV who cannot sleep because they know every time a law enforcement wants, they can just come and knock on the door. Not because there's an action or an omission of an action, just because of that identity. These are the policies that we're talking about today. And I think, as you mentioned, both of you, yes, there's a progress, there's a hope. It's been 40 years now, and then our target is in the less than 10 years. That should be a question that everyone needs to think about. How is this possible after all these commitments that we've had for the last 40 years? And then as for GNP Plus, and also as for, community member, I do believe that every day that we spend having this discussion, every day that we spend allowing people to listen to us and then showcasing what is missing is an important investment that we are making. Therefore, what needs to be done today is a very simple action. From a government perspective, we have data, we have scientific data that proves we are not going anywhere if these policies will sit around. And we know that we are lying to ourselves, we're lying to our citizens, that nothing can be really achieved by 2030 if we still have these policies around. I do feel whatever we do today, we have data, that's fine. We have government who are really taking time to listen and to question the data. By the way, before even I go to that point, those policies and those laws that we are referring to as well, we have to really mention that they are really outdated. Some of them have been established 30 years ago, and they are still there to remind people how we should end HIV. And it's in a very outdated policy, outdated philosophy, and outdated process and strategy. Where I was coming is we have a community which is very strong and working together, community for people living HIV, community of key population that we're working together. And then we have global health actors that are supporting. We need coordination, we need more support, we need more partnership, and we need to keep pushing government to really understand there are lives of people that are being threatened in every day. We have science, we have data that could really change the way things are being done, and that could lead us to the end of AIDS by 2030. What we need to do is to strengthen the partnership, keep this conversation, but also support the advocate on ground to keep pushing for government to think about people's life and question the data we have to make better policy and laws. I will end there. Thank you for your great presentation, sharing your data.
Thank you so much, Cedric. We're now moving on to Anjali. Welcome.
Thank you so much, Jen and Matthew and Cedric. It's great to be together. Let me first start off by thanking the O'Neill Institute and the Kaiser Family Foundation for hosting this important discussion. And really, I think, Cedric, I'm just so I feel honored coming after you, because I think you really brought to bear the importance of policy intervention and the endpoint, which is the people that we are trying to serve and reach through these policy interventions. How well are these policies actually adopted and implemented for you and the others that we are serving? You know, where is the commitment, just as you described earlier? In my remarks, I'll talk about three things as it relates to this discussion here. The first is a real fact, and I think Matt and Jen in your presentations, you really elevated and amplified the data around this, that supportive policies matter. They really matter. And when adopted and implemented, I would add, and implemented at every level, national, provincial, district, and at the site of where people are served, at the clinics, in the communities. And if implemented well, they really matter. They make a difference. You've shown in your data how we can optimize HIV services for the people that we're serving. You've also shown in your data, and we've seen so clearly over the many years, but really some policies move with speed through COVID-19. So what's possible? You've been able to show, and we've been able to see, working with countries and communities, what's possible when policies move fast. With multi-month dispensing, 3 and 6 months multi-month dispensing, differentiated drug delivery, universal test and start, these kinds of policies, when implemented at scale with speed, what is possible in clinical service delivery. And this is not something new. I mean, this is something that, PEPFAR with our previous Ambassador Birx really pushed on policy. And your data show the results of that positive push over the many years, and what, again, how clinical services have really moved as a result of these policies being in place. It's extended our reach It has maximized our resources when we have policies that work for the people we serve. The second point I want to emphasize is a gap. And this also comes out clearly in the data that you showed. And Cedric, to the very points that you raise, despite the incredible progress that countries are making and that we've seen with policy interventions moving and clinical services and frankly, countries making incredible progress toward epidemic control, inequities exist, inequities persist. We see gaps, and we see this in policies, but we see it in the way policies translate into program. We see gaps in services for children. We see gaps in services for adolescent girls and young women. We see gaps for younger populations overall. We see gaps in key populations, just as Cedric was noting as well. And these very gaps, will continue to persist unless we move in perhaps a different way that requires a different kind of partnership. We know that we need to we need to really look deep and make sure we're tailoring services to address and close those gaps. But we also know that there are policy environments that hinder that progress that could be possible. We know we need to address stigma and discrimination. We know we need to address human rights. We know we need to address, Cedric, you mentioned this as well, user fees and other things that hinder the ability of services to be delivered. And just as your data, both Matt and Jen showed, we're weakest on structural policies. And this is something that's not a surprise. It is hard to do. It is hard to do. It's hard to do well, and it's not possible to do unless we partner in a different sort of way. So the third piece I want to talk about is the opportunity that we have in front of us, and that we are trying to mobilize on through our country and regional operational planning process. It builds upon the incredible work over the many years, but really builds upon incredible work that has happened in the recent past, where we've really tried to push on policies and services and systems. So with COP22, we really see an opportunity to catalyze a focus on addressing inequities and tackling structural barriers. Again, all in the service of people and ensuring that clinical services are being received by the people that need them most. So we've made a number of advances in the COP22 to try and bring some additional focus to this. One of the things that we've done is we've added an equity pillar to our focus. Again, building upon the strong foundation of accountability, transparency, and impact, but adding a guiding pillar to that as a key theme for COP22. And this is really to demonstrate effective efforts to tailor services, close gaps, and address barriers faced by vulnerable populations. We've also, through our country operational planning guidance, emphasized equity and bring an equity lens to our efforts. And there are three key goals that we're seeking to achieve with countries and communities. First, to accomplish the mission, achieve and sustain epidemic control using evidence-based, equitable, people-centered HIV prevention and treatment services. The second, around enduring capabilities, resilient and capacitated country health systems and communities, enabling environments and local partners. And the third, lasting collaborations. And this really speaks to the broader partnership that is required, strengthening cooperation and coordination for greater impact, responsibility sharing, and sustainability. We've used the basis of the minimum program requirements, and this is something that has been really, really important that PEPFAR has really been pushing to really institutionalize critical policies, systems, and services that are required by the people, for the people we serve. So we've added a couple of minimum program requirements, or placed emphasis on some of the minimum program requirements to really try to institutionalize this focus on equity and structural drivers that need to be addressed. We've added, for example, in support of the targets set forth by the Global AIDS Strategy and the commitments expressed in the 2021 political declarations, that PEPFAR-supported countries must demonstrate evidence of progress towards advancement of equity, reduction of stigma and discrimination, and promotion of human rights to improve HIV prevention treatment outcomes for key populations, adolescent girls and young women, and other vulnerable populations. That's just an example. And again, this brings focus. It pushes the conversation. It allows us to track more closely with the governments, with the communities, with our teams to make sure we're making advances in this area. We've also, again, building on the strong foundation, we also know that local partner implementation is really important to the work that we're doing. And we've, for example, really tried to bring additional focus on increasing funding to key populations-led organizations, women-led organizations. These are just some examples of how we're trying to advance these policy type interventions. Ultimately, the gaps that we see in populations served. So coming at it from biomedical interventions, structural interventions. And again, you'll see that this is not new for PEPFAR. When you look at, for example, the work that we're doing through DREAMS on HIV prevention among adolescent girls and young women, we've always tried to take a comprehensive approach in that we're focusing on biomedical interventions, structural interventions, as well. And so again, I just wanted to end with the opportunity that we have in front of us as we look to the future and really try and push further to help close some of these gaps and take a greater focus on addressing structural barriers that impede progress for HIV prevention and treatment services. So I'll stop there, Jen and Matt, and turn it back over to you.
Wonderful. Pardon. Thank you, Anjali. Thank you, Cedric. Thank you, Jen. We're going to open up as we do our next 15 minutes or so to the audience. And so if you've got questions, please go ahead and put them into the chat or into the Q&A box. Apologies, not into the chat, into the Q&A box, and we will ask them as we go. And so let me just dive kind of right into that. And Cedric, I think first question to you. There's a number of different questions in the Q&A that are asking kind of about how do we actually achieve policy change? And, especially, GNP Plus with the Love Alliance and a variety of other really powerful activities is moving a policy agenda. And so as you think about what you want from the global health, major global health actors, right? The PEPFAR, the Global Fund, the others, what do you see as the kinds of investments that PEPFAR, Global Fund, private investors can make to support advocates in countries that are working on some of these most critical issues, whether it is, kind of the decriminalization or getting people the very best treatments for pediatrics or some of these others. What do you want to see from the global health actors? Go for it.
Thank you so much. That's a very good question, and I think it's timely as well, and as I have PEPFAR representative on the panel, I can also direct the answer. Thank you, Matt. So I think one of there are three things that could really help directly. The first thing I think is to continue doing the funding for community and key population-led organization, but then doing it more systematic way. What I mean, if I say systematic way, is like, I think it's important that we take the funding for community not only as a strategic intervention, but also as a guiding principle on of the funding, which means we have funding community for the work they are doing need to be part of whatever investment that PEPFAR is making or any other global health actor is making towards changing changing the law and policy, but also any other interventions. Guiding principle should be supporting and funding community. That's the first thing. The second thing is the engagement, not only in engagement in how we designing this the policies, but also supporting the engagement of community in discussions towards influencing the change and reforming the policies and law at country level. The global health actors have a powerful voice. They have a powerful voice and they have influence, whether at global or country level. We have to make sure that they use this powerful voice to support the engagement of community. A lot of these spaces are really closed, and then we all know that, you know, there's a study that was published by UNDP how civil society civic spaces is shrinking dramatically, and we have to use this powerful voice to make sure that community and civil society are engaged properly at global country level, especially when it comes to form or change this harmful law. The third, and I would say that the last thing here is, I mean, I don't like to say, but we have to mention it. A lot of commitments made by also global health actors towards supporting policy change doesn't have enough force or conditions to make sure that the promises that countries or government make can be made by using the forces we have to make sure. I don't know if I'm not naming things correctly, but I think that there should be enough investment towards pushing for funding to do what they are meant to do. It happens a lot, and I think some of the examples they took by themselves were coming back to the engagement because we promise engagement because we seeking funding, but then the funding is there, nothing is happening, and then so I think that's an area that should be really also should help to support the change and reforming of these harmful law and policies.
Thanks, Cedric. Let me come next quickly to Jen for a question here. There's a couple of questions here for you from people, and let me pick kind of two for you to take on. One, do we know anything kind of in terms of the analysis that you've done? Is there any evidence on kind of countries where that have graduated from PEPFAR? Is the question, kind of where PEPFAR has been decreasing and kind of emphasizing those pieces? Do we have any evidence there about kind of what's happened on policy? And I asked this knowing the answer is that we haven't done a great job of giving you longitudinal data, so I'll give you an out on that one, but I'm curious what your thoughts are. And then second, kind of what tools or leverage do you see the various global health actors that you think they're underutilizing in terms of this facilitating and supporting and encouraging governments to adopt optimal policies? There's I think a really important balance here, and I'm going to come to Anjali next on this, of kind of, what we don't need is kind of colonial structures that move toward, using money as in ways that are problematic. But what do you see as kind of the ways that whether there are tools to move things from a funder without a kind of colonial overtone to how we move things, which I think has been a really important kind of move in recent years. Over to you, Jen.
Great questions. I was monitoring the Q&A. There's some really terrific questions there. On the first one, I saw that, what do we know about countries that have graduated per se from PEPFAR assistance? This is a big issue in development aid, right? That when if a donor is leaving a country or transitioning out, If there's not, the conditions aren't right, some of the policies could just go by the wayside or not be implemented or even be repealed. So this is a big issue. I think in the context of, first of all, there's no longitudinal data that we were able to look at, so we can't answer that right now. I think though with PEPFAR, PEPFAR has graduated very few countries. So there are a few countries that have gotten little bits of money here and there over time and no longer do, but a lot of the countries, the main countries that receive PEPFAR support today have been receiving it for quite a while. So I think that's it's a hard one. It'll be a hard one to answer, but to me, that's the question for the future. As PEPFAR begins to change its relationship with countries and promote more domestic accountability and response, the monitoring of the policy environment over time needs to continue. On the second question of what tools are available, I don't have any magic answers at the tools that I think we're using the tools, but diplomacy is a powerful tool. Diplomacy done right. That donors, whether it's PEPFAR or the Global Fund, UNAIDS in its role, have a powerful role to play in a diplomatic sense of talking to peers in countries about why the policy environments are so important and so much a factor. I mean, I think COVID-19 can actually shed such a bright light on that, and so it provides a new opportunity. That's one. Two, data. Any data doesn't always change minds, but it's a very powerful tool to sort of see when there's enabling policies in countries, you actually can have better outcomes. And if that's the goal, that's really important. And then the third that I think is utilized to some extent, but probably could be utilized further, is regional action. So if there's some of the policies are really hard for an individual government to take on, or for civil society in one country to really be pushing. But if a regional alliance can be brought together to discuss that issue, I think it really might have, there's better power in numbers. I mean, I'll let Anjali talk about this, but user fees, for example, I know that you and others tackled that somewhat in a regional sense. This was a problem, not just in one country, but in several countries, and kind of bringing that forum together might be a way to not single out any country, but allow a regional platform to address it more broadly. Thanks.
Great. I've got a few questions for continuing, but I'm going to go for a second to Mandeep Dhaliwal from UNDP, who has been a big supporter of the work on this, from whom we build a lot of this work off of the Global Commission on HIV and the law that UNDP led. And so over to you, Mandeep, and then I'm coming to you next, Anjali, with a few from the Q&A. Cynthia, I don't know if we need to do anything to make Mandeep able to speak. It is also possible that I'm calling on you and you can't actually do it because of okay, I've gotten the technology wrong. So with apologies to Mandeep, can you submit it there? It turns out that we're not able to bring you in live. So with apologies there. So Mandeep, please come in and we'll describe it there with my apologies on misunderstanding the tech. Anjali, let me come to you then for a moment here and ask kind of two questions. One has been kind of, we're seeing different kind of questions come in around the implementation of policies. And you raised this, right? Which is, what the Policy Lab tracks is the existence of laws and policies. What is there? And I think one of the things that we have seen over and over is that there's a sense that, as Cedric said, 40 years into the AIDS epidemic, 25 years into the kind of serious global response, policy is no longer a barrier, it's not a problem, right? And what we have seen when we look is that is not true, right? The vast majority of countries have not aligned many key policies to where we think they are. I think there's an overestimation of how much the actual policy as written is aligned. But of course, that is only one piece of it, right? We're not measuring the implementation side of things. And this is where it gets complicated. So I'm curious if you might discuss kind of challenges and opportunities from the PEPFAR side when you think about kind of implementation, et cetera. And then the second question is, how are you thinking about kind of the role of PEPFAR in the kind of global to domestic space? One of the most interesting findings from the Policy Lab is, to just put a fine point on it, the United States does not have the highest policy adoption score, right? We, as you know, as an American citizen, I will say that we don't have, there's a lot to be learned kind of domestically, et cetera. So I'm curious if you have thoughts on kind of learnings from PEPFAR that might inform kind of domestic work too, because one of the core pieces has been this kind of thinking about global to local pieces. Over to you, and sorry for background.
No, terrific. Thank you. Thank you for those questions. And yes, I've been also scanning the questions in the chat, and maybe there's a way we can offer responses later, because I know we're not going to be able to get into all of those. But Matt, to your first question on some of the implementation challenges, and again, I think we definitely all have to be thinking about policy adoption and then policy implementation, because if it's adopted, if the what is there, that's great. But if it is not actually implemented and impacting people, then there's a problem. I think just one thought to offer, in terms of opportunities, because we do see the challenge of it, right? We see policies on the books, but they're not implemented and implemented effectively, at the point of service delivery, at the clinic or in the communities. One of the things that PEPFAR has been doing now for a few years and has continued to, really find value in this is community-led monitoring. And the opportunity, the continued opportunity that presents to help us really make sure that policies are being implemented in the right way for the people we serve at the point of service delivery, in the communities, in the clinics. And we've gotten such rich data coming out of community-led monitoring in country after country that helps us really make sure that we can then appropriately push at various levels of the government, at district, at provincial, at national, to make sure that policies are being implemented effectively. So I would just say, that's something that has worked effectively, community-led monitoring. We need to do more of it as well. And this is something that we're building upon and continuing to focus on as we move forward. On the second question related to PEPFAR's role in global to domestic and domestic to global, that interchange, that I think is something really, really important. I think it's very, I really appreciated seeing the full spectrum of the globe when you talked about the policy adoption, because we in the US, we have to own where we're doing well and where we're not doing well, and we have to figure out what we can do to change that. And I think that the global perspective, particularly some of these policies that have moved very quickly and have incredible impact, how we can really help show the way, or the countries can help show the US the way of how this has happened. The other piece that I think is important in the global domestic space is data. The data and the way data are used to change program, to change policy, in the global space through the global HIV response has been tremendous. And I think we need to do more of that here domestically. So we're exploring ways where we could have broader touch points of linking the global to domestic and vice versa. And I'm looking forward to those discussions. Thanks.
Thanks, Anjali. So let me just read as we kind of move toward concluding, and I know we're basically at time here, but to kind of read a few of the pieces, just not that we're going to be able to answer them all, but just, one, and thanks, Mandeep, and sorry for not being able to bring you in live as I thought we could. As we heard from Cedric, Anjali, Jen, and Matt, there's an important opportunity to scale work in addressing structural barriers, including criminalization, even in the face of law and policy implementation gaps, punitive and discriminatory laws, policies, and criminalization of key population organizations. There's many of innovative community-led strategies to deal with these, and they need to be supported and scaled while we work for legal change. And I think that touches in part on what you were saying, Anjali, around kind of how do we actually build the systems that are able to respond. And I think there's a few other pieces in here, but I'll leave them, and I think we can capture the questions and maybe respond back. We've got the list of folks who participated here, and we'll leave it there. Let me say a few things in closing. The Policy Lab was really created, and with thanks to PEPFAR for support, with thanks to UNAIDS and all of the co-sponsors that participated in this, particularly WHO and UNDP that had a significant role in pulling together the thinking on this. Thank you to GNP Plus that's really guided the work on this, and thank you to Kaiser Family Foundation for putting together this really important event. You know, this in part is a first step in the 2022 conversation. We've had a number of pieces here, and I want to just say two takeaways. One, you know, as we think about the role for kind of activists, for civil society, for governments, for international organizations, and importantly for funders to really support the policy environment changes that are out there, there can be despair, as if policy change can't happen. And I think the core is that actually over the last few years, the lesson we see is that policy change is deeply possible, including on complex things. I think, for example, of Angola, where, you know, Angola has been one of the countries that's actually had the biggest struggles to actually, you know, match countries in Southern Africa around reductions in incidents, has recently moved to decriminalize gay sex and replace it with a non-discrimination law. These are the kinds of policy changes that are possible, and they're not, you know, they're not kind of decades that we have to wait, right? But the question is there funding, is there capacity, is there support? And it's both there in the global north and in the global south. One of the other key pieces that I would say here is that the Policy Lab shows, and this aligns with UNAIDS data, that where the majority at this point, not the vast, but the majority of new infections of HIV are happening in middle income countries. They're not happening in low income countries, they're happening in middle income countries. These are places where the policy environment is incredibly important, and where civil society is particularly in need of support, where government officials who are making policy change and aligning it are in need of further support and as we move. So this is a key thing. And then finally, I'll just close by thanking everybody for joining us here. You know, this is a piece of a dialogue. Thank you, Jen. Thank you, Cedric. Thank you, Anjali. This is a piece of a dialogue that's ongoing. This idea that policy is an intervention, this is how we get to the end of AIDS by 2030. We don't get there without it. UNAIDS has modeled this, and we cannot get to the levels that we need in our current policy environments. And so the bottom line is this is the only option we have. So let's work together, move those pieces, and actually get back on track to end AIDS by 2030, not just in some countries, but in all. So thanks very much, all. Appreciate you all being here, and have a wonderful rest of your day.
Thank you.